Dear ladies and gentlemen, my name is Teresa Strabova, and I would like to introduce you our new promise in treatment of blepharitis and associated dry eye disease. This is general definition of dry eye disease. It seems to be really high prevalence, about 75% in people over 60 years old. And epidemiological evidence suggests that dry eye disease is mainly evaporative in nature and it's often associated with meibomian gland dysfunction. And the prevalence is about 70% in Caucasian population. I would like to present new modality of treatment of dry eye disease with Jett Plasma Lift Medical. This treatment is based on physical principle of plasma emission to treat the skin and mucous membranes. And the generated discharge can change the polarity of cell membrane, permeability for nutrients and associated anti-inflammatory effect, improve the liquefaction of the volume of meibomian gland, dissolve the plaque on its orificium, and make tears more balanced. You can see short video, this is the link, and we can use two techniques, one is contact and one is contactless technique. And I will introduce the contact technique with silver tips. It induces depolarization of the cell membrane and it's intended for mild and moderate degree of meibomian gland dysfunction. This is the protocol of the treatment. We use 3 mm silver tip, it's this one. And after using of topical anesthesia by drops and topical protective gel and conductive gel, we use the tip for 2 minutes per eyelid. The energy is increased in level from 3 to 8. And it depends on the tolerability of the patient. Next session is after 1 week and there 4 times repeated. This is short video of plasma pen. It's a silver tip in conductive gel, and you can see the liquefaction of meibomian gland volume. We make a prospective study for eye mucosa treatment to decrease symptoms or cure blepharitis and associated dry eye disease. The treatment was by contact techniques, by silver tip, plasma emission, by plasma Jett Lift Medical. We make clinical and optometric follow-up. There was OSDI questionnaire, Nick-Booth and Schirmer test, and monitoring of the morphological changes in meibomian gland by oculus keratograph 5M and classify the changes with the Yenvis-Meibo grading scale. In 95% of cases in the cohort, there was a subjective improvement, and the average improve was about 25 points. These are scans from oculus keratograph 5M, and this is objectivized Nick-Booth test. Immediately after the treatment, the Nick-Booth improve. This you can see after 1 week. However, in some patients during the follow-up period, Nick-Booth returns almost to its original value. Here you can see the changes in tears meniscus before and after the treatment. Before the treatment, the OSDI score was 32.5 points. There was very big epiphora and lipid deficiency and high meniscus. And after the treatment, there was more stable meniscus. And the OSDI was only 12.5 points. This is my favorite patient. The photos are before the treatment and after 2 sessions, after only 2 weeks after the treatment, you can see the changes in Yenvis Maybo grading scale. Before it was about 2.4 score, and after 2 weeks we can see the changes in Meibomian gland. We can expect elongation of the glands, and the score was about 2 points. I believe that Jett Plasma Lift Medical is new promise in treatment of blepharitis and dry eye disease, especially with Meibomian gland dysfunction. Our new results will be completed by inflammatory tests and by monitoring of osmolarity of the tears before and after the treatment by eye pen osmometry. I expect that can be helpful to identify patients with significant ocular surface inflammation and autoimmune disease and objectivize our results of our treatment. Thank you for your attention and have a nice evening.